So now hopefully we've understood what a scoping review is, how it's different from systematic reviews, and some neat examples of many different scoping review topics. Now we can get into the actual steps of doing a scoping review. So the Joanna Brigs Institute is an international institute that does many different types of reviews and synthesis. And they actually produced a very methodologically high quality manual or methods manual for doing scoping reviews. And we see here they have 5 main steps for doing a scoping review. And you'll see a lot of similarities between the Joanna Brigs Institute manual as well as the Cochrane handbook. But there are some nuances and missing pieces and differences between the two, which we will highlight. So the first step is to start with a protocol. And as we heard from Kai Fayed and her team, they actually started with a protocol as well. And when we looked into our scoping reviews, we saw that only 13% of the 494 reviews actually reported a protocol. So this suggests that it is an area that might be worthy of improvement. And again, when we think of our Cochrane handbook, a protocol is recommended as well. The next step is to state your review question or objective clearly. This should be consistent with your title, and it needs to inform your eligibility criteria. And again, Kafaya in her example did talk about the broad question that you saw that she started with, which was looking at clinical governance structures in LMIC. This is a very, very broad, expansive topic. So that's why Kafaya and her colleagues chose the scoping review to begin with, to try to chart and characterize this literature base on clinical governance structures. So when we look in the literature in our scoping reviews, we saw that 97% of the scoping reviews did have a review question and objective that was very clearly reported. Moving on to eligibility criteria. So this will be used to guide your review as well as making decisions on the sources of evidence to include. And the rationale for each of your criteria or criterion should be clearly explained. So when we look at the scoping reviews, from our scoping review, we saw that roughly 80% of those scoping reviews, they reported clearly some eligibility criteria. The recommendation is to search more than one database. So again, this is consistent with our Cochrane handbook. And the search strategy should be comprehensive. They're also asking to detail the publication date and any language limitations. And if you do use language limitations, you need to provide a rationale as to why you would be using that. And in our scoping review, we saw that 93% of the 494 scoping reviews did indeed search more than one database. So the Joanna Brigs Institute, in their guidance, they do discuss reference list scanning. So they say that you can search the reference list of all of your included sources of evidence. And this could be searched to identify further potentially relevant sources. And I really like to note the wording of a scoping review is on sources of evidence, because we know that there's many different types of evidence that can be included in a scoping review. And as we saw with Kafayed and her team, they included all sources of evidence. So this is another nuance with systematic reviews, because often with systematic reviews, we focus on a study. So our unit is actually a study, right? Whether it be a randomized trial, an observational cohort study, et cetera, et cetera. Whereas with a scoping review, often we don't limit it to one type of evidence or one specific study design. We look at all sources of evidence. And when we looked at our scoping review, this was reported in 56%. So 56% did scan the reference lists of the included sources of evidence. So in the Joanna Brigs Institute, they discuss gray literature. So this is literature that is difficult to locate or unpublished. And they say, if gray literature is applicable to your review, question, or objective, then you can feel free to include unpublished literature or gray literature in your search strategy. So you can search for sources of gray literature in your scoping review if it's relevant to your review, question, or objective. And as I believe Kafayat was mentioning in her presentation, we saw how challenging it was to get this scoping review completed. They had to screen, 5,000 titles and abstracts because we're looking at so many different sources of evidence and our topic is so broad. So sometimes we may not have the resources to do a full gray literature search that we would like to. And I think as long as we transparently report that in our review, I think that, as with our Cochrane reviews, we want to make sure that we do have that transparency in reporting. So when we look in our database of the 494 or our scoping review of scoping reviews, we saw that roughly half of them actually did search the gray literature. So level 1 screening, so this is a screening of titles and abstracts, and ideally we want 2 or more people to screen. And again, this is very consistent with our Cochrane handbook, and I believe that this is what Kafayat and her team did as well. So when they were screening all of those titles and abstracts, we had 2 people screen these independently. So again, this would be consistent consistency between our scoping reviews and our systematic reviews in terms of the steps that we need to do. And when we looked at our scoping review, we saw only about 36% of the 494 reviews actually reported screening the titles and abstracts that was conducted by 2 or more individuals on the team. And then now we move on to level 2 screening. So this is looking at the full text articles that we've identified to be potentially relevant from our level 1 screening. And again, the Joanna Brigs Institute recommends that 2 or more reviewers screen these independently, which would be consistent with our Cochrane handbook. And in terms of how this was operationalized in the literature, we saw only about 30% again of the 494 scoping reviews reported having 2 people screen the full text articles. So now we move on to another key distinction between systematic reviews and scoping reviews. So for scoping reviews, we focus on charting. Okay, so we are charting your research question, whether it be your patients, interventions, comparators, outcomes. We're charting these in the literature. We could be charting the contextual factors, the population, the issue at hand. So it's more of a charting exercise when we're thinking about a scoping review versus full data abstraction in the systematic review. And so when we're thinking about charting, it's really important for us to have a charting form that's established a priori. And this will help keep a record of all the characteristics of the studies or the key sources of evidence and the relevant information for your questions. And you can iteratively refine this as you go, but it's often more efficient if you establish this up front. So what are the things that you will chart from the included sources of evidence. In terms of our scoping review, so we saw only about 43% of the 494 scoping reviews clearly reported this step. Again, we're now moving on from the charting form to actual charting. So this is when you are abstracting the relevant data, and this is done by 2 or more reviewers independently. And often when we're charting data in a scoping review, we may not be actually charting the results, or sorry, abstracting the results. So we may be more focused on characterizing the literature, but not actually abstracting the detailed outcomes and the results of those outcomes. So the reason for this is it really depends on your question. So if your question, your scoping review question, it is amenable to abstracting some of those results, then that's completely fine. But it's more in a way to see what has been done than versus coming up with a concrete answer as to, for example, whether this intervention or program or initiative is effective. It's more about demonstrating some of the results that have been found in the literature versus coming up with a single point estimate and a confidence interval, like what we would be trying to do in a systematic review, as an example. So when we look at the Joanna Brigs Institute manual, they say even for charting, this should be done by 2 or more reviewers independently. And when we see how this is operationalized in our 494 scoping reviews, we saw that this was conducted in about 30% of those. So the next step is to present the results. So using diagrams, tables, a descriptive format. It depends on the purpose of your scoping review again. So we saw with Kafayat, they actually started with a conceptual framework and they were trying to refine this framework. So in their results paper, they will be actually publishing that conceptual framework, and probably the one that they started with as well as the one that they ended with. So that would be a potential result from a scoping review. And when we look at how these were operationalized, we see about 80%. So the majority of them did present results in a meaningful way. So the Joanna Brigs Institute recommends the study flow diagram. So they want to make sure we show the decision process, the search results, the selection, additions from reference searching, etc., and the final number of included sources. So we saw Kafayat showed a very nice flow diagram for her scoping review, and that will likely be published in their report or the paper that they submit for publication. And this was a bit surprising to me that only about 50% of the scoping reviews actually operationalized this. So 50% presented the flow diagram in their final paper. So a big purpose of a scoping review is to identify research gaps. So they want us to know what these research implications are. And when we look at how this was operationalized, we see again about 80% or so of the 494 actually did talk about research gaps. And depending on your focus of the review, there might be some practice implications. So again, perhaps the purpose really is to identify gaps and chart the literature. You may not really be able to bring it to that level of implications for practice. And indeed, we see only about 50% actually did this, actually operationalized this in the 494 scoping reviews. So again, this is more of an optional step. So that was a summary of the Joanna Brigs Methods Guide. I would highly recommend for those of you who are doing a scoping review to consult the methodologically rigorous guide that was put forth by my colleague, Dr. Micah Peters, as well as Dr. Christina Godfrey, and all with the Joanna Brigs Institute. And it does give you a really nice way to walk through what a scoping review is and how they can be conducted. And at the beginning of the presentation, I did note that this is an area that we've been working on for the last few years. So you've heard me mention about probably 100 times my scoping review or our scoping review on scoping reviews. So the citation is here. So my colleagues, Dr. Kelly O'Brien and Cole Cahoon and all, also did some surveys and looking at what the terminology definitions and steps for scoping reviews are. And I did want to note that we are working on the extension to the PRISMA statement specifically for scoping reviews. And we're hoping that this will be submitted by the end of the year.